Morning everyone, I'm Stacy. I volunteer at the Kenya Red Cross Emergency Operations Center. Currently on my way to work. I have a full day at the office today. So I'm going to show you what a typical day for me as a volunteer at the Emergency Operations Center is like. Thank you for calling Kenya Red Cross. Hello. When COVID-19 set in on a typical day, we handle calls that deal with people who are having anxiety, who are feeling scared about the situation. There are those who are worried about their food situation in the homes. We work in shifts here at the EOC. We are around the clock 24/7, and we happen to have a counselor who is always on duty for those who need counseling services.
Psychosocial support is very critical because apart from addressing the physical, the economic, the social well-being of the public, it's also very important to know that they are also affected mentally.
Being the Red Cross Emergency Operations Centers, we get calls of emergencies, mostly like road accidents. We have floods that are threatening to come in. We have drought that started to affect some areas at the coast. So we kind of monitor all those situations at once from here. Things have just gotten so serious that it's just changed the whole atmosphere. You can tell there's a change everywhere. I can see the impact of what I do. We might not be there on the ground with the people, but being able to give people an avenue whereby they can air out their issues and feel like they've been heard. And what I would like the world to remember is the fact that as much as we are keeping physical distance, we still have our phones. So call your friends, call your family members, especially the ones that you know are in isolation. It's okay to ask for help. If you feel things are weighing down on you, feel free, call anytime, any day, even at night, and you'll have someone who will be able to speak with you, even if it's just to have a conversation.